Thank you, Max, and thank you, Deputy Cairns. I think, in one word, it's devastating, is the impact. And I think, depending on whether it's an acute injury, maybe like a head injury, or even a diagnosis which is a brain tumour, stroke, or a neurodegenerative diagnosis, Parkinson's, MS, or many of the other motor neuron disease, the impact is devastating, and it goes across a range of functions because the complexity of the brain is so difficult and so high. You can have significant physical disabilities which limit your capacity to interact with the world physically. You may have paralysis, you may have substantial hemiparesis, limb difficulties, visual sensory problems, auditory sensory problems, headaches, balance difficulties, but also then the hidden pieces which are more challenging, and it's the piece that we see when people come back from the relatives are the psychological, the cognitive, and the behavioural pieces. So people present with difficulties with their memory, with their language, with controlling the world, planning, problem solving, a lot of sometimes volatile emotion or lability in emotion, depression, anxiety. We know about 40 to 50% of relationships don't survive a severe brain injury. They break down because there's no supports, and the person is different, the role has changed. Many patients with severe brain injury don't get back to work. Younger people don't get back to college, and they're stuck at home, and they need substantial support. So organisations, for example, like Headway and Acquired Brain Injury, their voluntary bodies and Quest in Galway do an enormous amount of work to try and get people back. But it's a drop in the ocean, because they really should only be at the last stage. The patients that they and the people that they see should have gone through a significant, maybe year or two of complex neurodisability before they even get to that. But at the moment, the voluntary bodies are scrabbling around for funding to try and provide these services for people living in the community who are trying to get back into the world again. It could be anything from just trying to get down to the shops to get your food. That's an enormous task for somebody after a brain injury. If you're forgetful, if you have a memory deficit, if you're maybe a little bit irritable. Even we saw during the early stages of COVID, patients couldn't learn the new things. So they were getting into difficult situations about masks and about social distancing because they just didn't understand the new rules. And that caused all sorts of conflict. And people in the community, I think there was a question earlier on about information. Most people don't really understand a brain injury because for many of the people, they look the same. They don't really look that different. I think, again, it's very similar to the autism issue. They look normal to everybody else, and yet they are struggling with an enormous amount of difficulty on a daily basis. And then you add in the caregiver piece onto that, where you have a relative, sometimes a child, trying to care for the relative, trying to get them back into their life and back into their community again. And it is such a struggle. I see people coming back into the clinic maybe a year or so after being discharged. And if you take an acquired brain injury, a car accident, even coming off your bicycle, I think I probably see 2 or 3 bicycle injuries every week from concussions. Even those can knock somebody out for a year after their accident because they don't have services. They can't get back to work. They can't get back to college. They struggle and try. Their mood deteriorates. We see it after sports concussions. So they're at the tip of the iceberg in terms of the mildness. And if you go right down to the extreme ends of severe brain injury, then where they need residential care, you've got young people maybe in their 20s in nursing homes for the elderly, and they're sitting in the corner of a room without any resources of any kind. So the impact on a daily basis for somebody with a neurodisability is enormous and takes its toll on the famous quote that a brain injury is a family affair. It takes its toll across the family. Spouses quite often, unfortunately, as I said, they break down, and then children and young children are really affected by an adult with a brain injury in the family. Their life changes overnight, and there's no resources to facilitate that. They should be getting family therapy and counselling as well. So, that's the importance of the neurorehabilitation strategy, because it outlines that. I suppose the continuum of care that people should get from the point of their initial diagnosis and early treatment, when everybody's very optimistic. They go from a point maybe that they've devastating diagnosis of a brain injury, they survive, they get out to the acute hospital, everything is great and positive, and suddenly they're lost and they have no idea where to go and who to turn to. And that's why the neurodisability strategy and neurorehab strategy is so important, because it gives them that framework and scaffolding that allows them to benefit from the rehabilitation.
Okay. Anybody else want to come in? I know, members, if you could bear with me a second, because I tell you, I see that Alice Mary has to step out.